So today I'll be talking about postpartum hemorrhage, something that was really drilled into our head. So I have a pretty good um, grasp on this. So the definition, all this information is from our book. It's potentially life-threatening complication that can occur after both vaginal and cesarean births. So it's defined as a blood loss greater than 500 cc's after vaginal births and more than 1,000 cc's after cesarean births. This is not a final answer, like a number. This is like the minimum, and a lot of women, bleed more than that. So who's at risk and risk factors? All mothers postpartum are at risk. Some risk factors include lacerations of the genital tract, an episiotomy, retained placental fragments, uterine inversion, coagulation disorders, large for gestational age newborns, failure to progress during the second stage of labor, placental acrita, induction or augmentation of labor with oxytocin, a surgical birth, and hematoma of the vulva, vagina, or subperitoneal areas. So some signs and symptoms: a soft, boggy uterus that deviates from the midline even after the bladder is empty. Uterus remains large with painless dark red bleeding mixed with clots. Slow, steady blood loss. It can include some severe perineal or pelvic pain, difficulty voiding, hypotension, tachycardia, and anemia from the blood loss. Some complications include blood loss, anemia, shock, or hemorrhagic shock, and the most extreme is maternal death. So some management. Massage the fundus. That was the first thing we were taught to do. Administer a uterotonic drug. Maintain the primary IV infusion. Check her vital signs. You can put the baby to breast if it's minimal. Assess for retained placental fragments. Assess for signs of hemorrhagic shock. Institute emergency measures if DIC develops, and administer blood products if indicated. So some nursing interventions are pretty much the same as the management. Fundal massage, IV fluid resuscitation, administration of the uterotonic medications, bimanual compression, internal uterine packing. Usually bimanual compression and internal uterine packing is done alongside a provider. So some pharmacologic treatments. You can start an IV of oxytocin. This stimulates the uterus to contract, and it contracts the uterus to control the bleeding from the placental site. The misoprostol, this also stimulates the uterus to contract, and it's a prostaglandin, and it reduces bleeding. The dinoprostol, it's a rectal or vaginal suppository, and it's also a prostaglandin. The methergin, that stimulates the uterus, and it prevents and treats postpartum hemorrhage due to atony or subinvolution. And the Hemorrhage, that also stimulates uterine contractions, and it treats postpartum hemorrhage due to uterine atony, and when none other methods are able to control the bleeding. And that's it.